tell me a little bit about the three abortion bills that were passed by the committee today.
Sure. First was fetal disposition death certificate, and that really stemmed from the Indiana doctor that transferred 2,411 fetal body remains from his abortion clinic into the state of Chicago, and certainly speared a lot of frightening memories for women who had gone through an abortion and then to find out that the remains of their children were kept in a jar for years. So we obviously passed that one. It was great to have a funeral director on our committee that could give some insight as to how that process would work, and that was a positive, I believe. And then on the second hand, we did the informed consent, and as I said in committee, there's not a woman that wouldn't do anything to save the life of her living child if she had the option. And why shouldn't a mom who changes her mind after a medical abortion have that same option? And so the drug isn't dangerous, it's progesterone. We make it. And so, to state that we aren't being truthful or we're having a doctor lie about what this drug does is just an anomaly to me. I don't understand how we would tell people that information for women to make their own decisions is bad when that's what they tell us all the time, is let women make their own decisions. Let's just give them the information. The last one that we just did was abortion clinics, and I'm flabbergasted that the state of Iowa has never licensed abortion clinics. When we talk about them as healthcare providers for women, we wouldn't go to a hospital that's not licensed and inspected. We wouldn't go to an acute care that's not licensed and inspected. And with that being said, why wouldn't we license another healthcare provider in the state? And I think that's just a protection for women and families that are using these clinics as their mainstay of healthcare. And I think it's the right thing to do to make sure that we've got that consumer protection in line.
Okay. Did you hear anything from the opposition today that was new to
No.
you?
Okay. I've been running abortion bills here since I was elected in 2016, and the arguments have been the same since 2016. So it's certainly an opposition that just continues to go back and forth. I don't think we're ever going to come to an agreement on this issue. It's one of those 5 issues that Republicans and Democrats will disagree on. But the other work that our committee did was in bipartisan fashion, and about 90% of the bills that we passed, maybe even a little higher, were voted with bipartisan support. So I think it's important to look at the context. And as a pro-life caucus, we're going to try to do everything we can to move pro-life legislation, but that doesn't mean that on the other side we're not working together to pass bills that we all agree on.
Yeah, so tell us what happened in the committee meeting today, particularly about abortion.
Sure, yeah. So a controversial topic, strong emotions on all sides. The bill that was brought out as having the most concern would essentially be requiring doctors to misinform their patients about medicated abortion and the reversal of that. My concern in particular is that the bill that was talked about today was based on misinformation. It's based on a 12-person study, 3 of which ended up in the emergency room bleeding out. And it is something that is going to require doctors to essentially misinform their patients. It's a dangerous bill. It puts women's health in jeopardy, and again, strips women of the freedom to make informed healthcare decisions. One of the things that is heartbreaking for me is that as someone who is deeply committed to women's reproductive freedom, also deeply committed to my faith, we need to recognize that women are morally capable of making thoughtful and informed healthcare decisions. And when a room full of legislators who are not doctors are legislating that, we are stripping women of the human dignity that Republicans are often claiming they're trying to achieve. So it is a frustrating and exhausting conversation, but one in which that, I am constantly willing to listen and learn more. At this point in time, I think that piece of legislation is dangerous for women's health, and I was a clear no on that. Will continue to be a clear no on that.